coronavirus didn't seriously affect children, although more recently, young children have died of COVID-19 in the United States, and now appears some children who have had COVID-19 have developed symptoms similar to an autoimmune condition. Pediatricians are finding their patients and practices greatly affected by the COVID-19 pandemic. So I am thrilled to be joined by Dr. Eric Ball, a primary care pediatrician at Southern Orange County Pediatric Associates. He is a board director of the California American Academy of Pediatrics and a leader in quality improvement. Thank you so much for joining me, Eric.
Thanks so much, Dr. Pan. And then we're also proactively looking at kids whose immunizations are not up to date and calling them and trying to get them in the office. We're already worried about flu season, which is coming up. We're worried about having flu cases on top of COVID cases in the community, which is scary, and we're already talking about our strategy for flu clinics. And we're probably going to start doing some outside-of-the-box things like drive-through flu clinics or flu clinics outside where we can physically distance our patients and still be able to get their flu vaccines on time.
I appreciate you raising the flu vaccine as well because the director of the CDC basically expressed concern about a concurrent wave of both coronavirus and flu next fall. This year, actually, coronavirus came at the tail end of flu season, and what we're worried about is coronavirus coming back in the fall at the same time as the flu. And while we don't have and we won't have a COVID-19 vaccine by next fall, we certainly have a flu vaccine. And right now, only about 40% of people get their flu vaccine. For children, it's a little higher, but we really should be at 70 or 80% or even higher. So I appreciate what you talked about, thinking about what can we do out of the box. I don't know if you have any thoughts about, from a policy perspective, as a pediatrician, what we should be doing to try to boost our flu immunization rates so that our hospitals aren't overrun with both flu and coronavirus at the same time.
Yeah, I think we have to increase the capacity and the availability of flu vaccine everywhere. I mean, I'm a big proponent of being able, be able to give flu vaccines at schools and places that are not the traditional places like pharmacies or doctors' offices. I also we have a meeting actually coming up next week to talk about this for the future, and we're talking about ways that big groups of practices and community leaders could all get together to try to coordinate more community-driven flu vaccine clinics. We want to get this out of just that you go to the pharmacy or you go to your doctor's office and get a flu vaccine. We want it basically to be available wherever you need it, because a lot of our patients, especially the older ones who don't come to the office very much or aren't sick, they don't even think about a flu vaccine. So not only do we need a public health messaging, we need to get the word out about how important it is because, the symptoms of COVID-19 and influenza can be quite similar. And, we were somewhat fortunate that we caught COVID at the end of our flu season, so our hospitals had some capacity. But in the midst of the winter, our hospitals baseline are quite full with flu patients. And thinking about getting a lot of COVID patients on top of that is a really scary proposition.